How to increase your sperm count. One of the commonest questions which infertile men ask is, how can I increase my sperm count? And if you want to find out the answer to this question, please watch the entire video. I'm Dr. Malpani. I'm an IVF specialist and I run Malpani Infertility Clinic. Now, the one thing which most infertile men obsess about is their sperm count. They all know there's a correlation between their sperm count and their fertility. But the problem is they're exceptionally naive about this. They think it's a direct correlation. The better the count, the better the motility. And sadly, this is not something which doctors explain to them or tell them why this thinking is flawed. And I'm going to spend some time explaining to you exactly what the logical limitation of the correlation between sperm counts and fertility is. Remember one thing, you don't really care what your sperm count is. Your question is, can I get my wife pregnant or not? Never lose sight of that. And also don't lose sight of the fact that we can't answer the most important question you're asking us as to whether your sperms are fertile or whether they can get your wife pregnant or not. And because we can't answer the most important question, we end up answering unimportant questions because patients want answers and doctors feel obliged to give them. So we all know that the job of a man is to produce sperms and these sperm will fertilize his wife's eggs, which is why the first test we do for a man is a sperm count. Easy test, cheap to do, and that's actually where a lot of the problems start. Because a lot of the times the sperm count is reported as being low. Let's start from here. Step number one is that most labs cannot do a sperm count properly. Counting the number of sperms is actually extremely hard to do. You need specialized sperm counting chambers, which often lots of these labs don't have. You'll be surprised how many of them don't. And because it's such a cheap test, it's usually the poorly paid lab technician who does it and writes whatever number he likes, which is why you'll see sperm counts fluctuate so much because they're all done from unreliable labs. So A, you can't trust most sperm test reports from the lab because most labs are not very good at doing sperm tests. Remember this. Secondly, you can't just test one report and jump to a conclusion based on it. We know that even for a fertile man, sperm counts fluctuate from week to week. So that even if your first count is low, you don't need to panic. You need to wait 6 weeks and repeat the sperm test again, preferably from another lab and a more reliable lab. Please remember these. These are all basics, but sadly we take shortcuts. We don't remember the basics. We're in a hurry to take treatment. The doctor's in a hurry to write a prescription and give you a treatment, and that actually causes more harm than good. And I'll explain to you why. Thirdly, lots of labs don't even know what a normal sperm count is. 50 years ago, the definition of a normal sperm count was 60 million per ml. Today, interestingly, the definition of a normal sperm count itself is changed, and any count of more than 15 million per ml is considered to be normal. Now, imagine the irony. If a man has a sperm count of 20 million per ml, 50 years ago, the doctor would have called him infertile. I would have started treating him. And today we say, yeah, that's okay, 20 million per ml is fine. It just emphasizes how little we really know about male infertility and the correlation between sperm counts and the man's fertility. Don't forget any of this before you start panicking. Then suppose you do your test and suppose it does come back with a low sperm count from 2 different labs. You still don't need to panic. Let me explain to you why. For one thing, it's not just the count. We also need to look at the sperm motility. And even if your count is not great, but your motility is fine, that's often good enough. And that's why we often multiply the two and we check the motile sperm count, which gives us a little more insight and a little more information. Also, you need to remember is that there will be men with a low motile sperm count who still have babies in the bedroom. Please remember this, which means no matter how low your sperm count, if you've got your wife pregnant in the past, you still have an extremely good chance of getting her pregnant again for 2 reasons. One is, we don't really know how low your count was when you got her pregnant the first time. Perhaps you never bothered to do it. And it's only now that you're testing. And again, this explains the fallacy, the lack of logic in correlating sperm counts and fertility. And you also need to remember is that it's not just your fertility we're talking about, it is the couple's fertility, which is obviously your fertility plus your wife's fertility, so that even if your motile sperm count is low, but your wife's fertility is exceptionally good. For example, she's young, her ovarian reserve is good, you're having frequent sex, you could still compensate and have a baby in your bedroom. And this obviously makes the matter a lot trickier and messier, because lots of doctors have seen men with motile sperm counts of as low as 3 and 4 million per ml who got their wife pregnant in the bedroom. So you can't jump to this conclusion straight away. Please understand this. Again and again, I need to emphasize the limitations of the sperm count before we talk about what we need to do to treat it. So let's go step by step. Stay with me here. You also need to remember one of the most important concepts for treating infertile couples is what is called the trying time, which means how long have these couples been trying to have a baby. Now, even if your motile sperm count is 5 million and you've only been trying to have a baby for 3 months, we're not worried. You may still get your wife pregnant. In fact, you have no business doing that sperm count so early, and your doctor shouldn't even have asked you to do the sperm count. If you've only been trying for 3 months and your wife was young with regular periods, you should have been a little more patient and waited rather than panic, and because every unnecessary test you do creates its own sets of problems. I understand you done the test to reassure yourself, hey, my sperm count is fine, I'm so virile, my sexual appetite so good, everything looks fine, and perhaps the doctor did it because it's a routine test. Okay, fine, let's test you, make sure everything's fine before we move on. But if you do these tests, some of them will come back as abnormal, and that's really when the problem starts. And then the last problem is men in their head correlate sperm counts with their bank accounts. Hey, obviously a higher bank account means you're richer and you have more money. So wouldn't the same thing apply for a sperm count? That if you have more sperm, your fertility is better? Not true. It's actually far more complicated than that. And that's exactly my point. So finally, what you've been waiting for. All right, I've heard all that. I understand. And doc, everything's okay. I understand what you're saying. And let's assume that I am now one of those guys who have a low sperm count, repeated twice and thrice from the labs. Tell me what I can do to fix it. I want an answer. I want a solution. I don't want to listen to all this theory. That's part of the problem. We don't have a good solution for increasing sperm counts. And not only have I explained all these reasons to you, because sperm counts fluctuate so that sometimes no matter what medicine I give, it may drop or it may actually rise. But we confuse correlation with causation and we think, hey, I gave this guy this particular medicine and that's why the sperm count rose. But actually there was no connection between the two. And you repeat a sperm count again and it's gone back to normal. Which is why all these medicines, whether it's Fertility, multivitamins, antioxidants, long list, they're all rubbish, they don't work. Now, let me explain one thing. The very fact it's such a long list is because nothing works. After all, if something worked, one medicine would have been more than enough. For example, if you have malaria, every doctor writes the same anti-malarial prescription. But when nothing works, doctors write anything. In the hope, matka lag jayega, lottery lag jayegi, jackpot lag jayega. Okay, this hasn't worked, let's try some homeopathy and some Ayurvedic. And everything works some of the time, but it's not reliable. And that's why nothing works, because we're really not sure. And the same problem applies with things like varicocele surgery as well. So here's a short summary. To step back, don't panic just because one sperm count report is low. Remember the correlation between sperm counts and fertility is very poor. Remember that labs are not very good at doing sperm tests, so you don't need to jump to conclusions, and you shouldn't let your doctor jump to conclusions either. And if by chance your sperm count is persistently low, then please don't waste money on medications or varicocele surgery or even things like artificial insemination. Because the doctor says, fine, we will concentrate your sperms and wash it and clean it up and put just the good sperms in. But if these sperms are functionally incompetent, then that's the key word. It's not a question of anatomy, it's a question of physiology, it's a question of function, it's not a question of counting. And even if you have very few sperms, but they're functionally competent, that's enough to get your wife pregnant. And even if you have lots of sperm but they're not functionally competent, you will not get your wife pregnant. That's the one thing we need to remember. And the problem is we don't really have a very good test for sperm function, which is why we're all muddling around in the dark and there's so much confusion, not just amongst patients, but amongst doctors, gynecologists, urologists, andrologists, infertility specialists. So try anything you like. Do it as a therapeutic trial, but be disciplined. Don't waste too much time. So you want to try Clomid? Go ahead, take it, but don't take it for more than 3 months and keep on checking your results. The good news is the best solution for the man with a low sperm count, no matter how low your sperm count is IVF-XC. Because what this means is what your sperms are not capable of doing in the lab, we will do for you in the laboratory. And the pregnancy rates with IVF ICSI, especially if your wife is young, are extremely good. And if you want to find out more about sperm counts, the problems with sperm counts, how IVF ICSI works, why IUI is useless, why all the medications don't work, please come to our website. It's www.drmalpani.com. We've got hundreds of pages on male factor infertility and sperm counts, all of which have been written by me. So I can vouch for the fact that they're reliable, updated, factual, and easy to understand. And if you have more questions, please ask me an email again from our website. It's a free service we offer, and I'm happy to offer you a free second opinion. And we look forward to helping you to have a baby. As an IVF specialist, nothing will give me more joy. See you.